Bismillahirrahmanirrahim. Assalamu alaikum. First lecture on laws of interest to medical profession. Laws of interest to medical profession. Pakistan Penal Code 1860 PPC, Pakistan Penal Code. Good faith, section 52. Nothing is said to be done or believed in good faith which is done or believed without due care and attention. So by definition, it means anything which is done with due care and attention is said to be done with good faith. Anything which is done with care and attention is said to be done in good faith. So example where a person uneducated in matters of surgery operated on a man for internal piles by cutting them out with an ordinary knife, and the man died from hemorrhage. It was held that he did not act in good faith, although he had performed similar operation on previous occasions. This is about the person who is not qualified, and if he performs operation of piles and the person the patient died due to the excessive hemorrhage, this thing is not said to be done in good faith because the person was not qualified. So this operation was not done in good faith even if he has performed such operation multiple times in the past. Section 80. Nothing is an offense which is done by an accident or misfortune or without any criminal knowledge or intention in doing of a lawful act in a lawful manner by lawful means and with proper care and attention. So if a work as operation is performed as a lawful act in a lawful manner by lawful means, the person who is going to perform has got proper qualification and he has also got experience and he has taken the proper consent of the patient. Then if anything goes wrong and by accident or by any misfortune the person died during operation or after the operation, if the act is lawful, if it is done with the lawful manner or done with the lawful means, it means all is required has been performed. So if the person dies during an operation, then it is not an offense. If it is by lawful act, it is a lawful act, it's done by lawful manner, by lawful means. Communication made in good faith. So good faith, anything done with due care and attention. Now communication made in good faith. No communication made in good faith is an offense by reason of any harm to the person to whom it is made up of benefit of that person. Now this is if a communication is made in good faith. It means it is not a crime if anything resultant may occur. कोई चीज़ आप इन गुड फेथ कम्युनिकेट करते हैं इसको किसी मरीज़ को, जैसे सर्जन या कोई डॉक्टर उस मरीज़ को कहता है कि आपकी अब ज़िंदगी को बहुत लंबी नहीं है तो आप जो है वो अपने मामलात को समेट लें, and due to this hearing this news by the doctor or the surgeon, person goes into shock and he died. So in this case, this communication has made in good faith, so the surgeon will not or the doctor will not be held responsible for his death, as due to the communication was made in good faith. A surgeon in good faith communicates to a patient his opinion that he cannot live the patient dies in consequence of the shock. The surgeon has committed the no offense, though he knew it is likely that the communication might cause the patient death. So any communication made in good faith is not a crime. Punishment for false evidence, ये झूठी गवाही की जो सज़ा है, ये whoever intentionally gives false evidence in any stage of the judicial proceedings or fabricate false evidence for the purpose of being used in any stage of judicial proceeding shall be punished with imprisonment of either description for a term which may extend to 7 years and shall also be liable to fine. And whoever intentionally gives or fabricates false evidence in any other case shall be punished with imprisonment of either description for a term which may extend to 3 years and fine. So अदालत में झूठी गवाही की जो सज़ा है वो 7 years है और उसके अलावा 7 जुर्माना भी हो सकता है. 7 year imprisonment और जो है जुर्माना हो सकता है अगर कोई अदालत में झूठी गवाही दे. और अगर कोई अदालत के अलावा कहीं इस तरह को काम करे तो उसमें 3 years है अपना इम्प्रिजनमेंट और फाइन इसके साथ जुर्माना होगा. Issuing a false certificate. So whoever issue, this is relating to the medical personnel, very much related as you know, multiple certificates are issued by the doctor: certificate of illness, certificate of fitness, certificate of age, certificate of injuries, medical legal certificate, death certificate, then the postmortem reports and the exhumation reports. So whoever issues or sign any certificate required by law to be given or signed or relating to any fact of which such certificate is by law admissible in evidence, knowing or believing that such certificate is false in any material point, shall be punished in the same manner as if he gave the false evidence. So जो किसी को गलत और झूठा सर्टिफिकेट इशू करना, इसकी सज़ा भी वही है जो कि अदालत में झूठी गवाही की है, और वो है 7 साल कैद और जुर्माना दोनों. तो कोई भी गलत या झूठा सर्टिफिकेट आप इशू करेंगे तो उसकी सज़ा 7 साल कैद है और इसके अलावा जुर्माना भी है. Malignant act likely to spread infection or disease dangerous to life. Whoever malignantly does any act which is and which he knows or has reasons to believe to be likely to spread the infection or any disease dangerous to life shall be punished with imprisonment of either description for a term which may extend to 2 years or with fine or with both. Now, any act which likely to spread the infection or disease dangerous to life. If a person use the unsterile instrument during operation, the patient may subsequently any disease, as he may develop hepatitis C, hepatitis B. So in that case, the punishment is 2 years imprisonment or fine or both. तो 2 साल की कैद और जुर्माना या दोनों हो सकती है. 2 साल कैद और जुर्माना, 2 साल कैद भी हो सकती है और जुर्माना भी हो सकता है जो कि बंदा कोई इन्फेक्शन फैलाने की कोशिश करे, जैसे कि अनस्टीराइल जो है ना इंस्ट्रूमेंट यूज़ करे, जैसे कि एक इंजेक्शन को एक बंदे के ऊपर लगाया है, वही इंजेक्शन किसी दूसरे को सिरिंज किसी दूसरे पे इस्तेमाल करे, फिर तीसरे पे इस्तेमाल कर दे. तो दैट इज़ द मैलिग्नेंट एक्ट लाइकली टू स्प्रेड इन्फेक्शन और डिजीज़ डेंजरस टू लाइफ. एडल्ट्रेशन ऑफ ड्रग्स, दवाओं में मिलावट. Whoever adulterates any drug or medical preparation in such a manner as to lessen the efficacy or change the operation of such drug or medical preparation or make it noxious, intending that it shall be sold, used for, or knowing it to be likely that it will sold or used for any medical purpose, or if it had not undergone such adulteration, shall be punished with imprisonment of life with fine which may extend to 1,000 rupees or with both. जो दवाओं में बंदा मिलावट करता है तो उसकी सज़ा है जो वो लाइफ इम्प्रिजनमेंट है. जो भी बंदा दवाइयों में मिलावट करे उसको लाइफ इम्प्रिजनमेंट हो सकती है और जुर्माना दोनों हो सकते हैं। जुर्माना जो है वो सिर्फ 1000 रुपीज़ तक हो सकता है, लेकिन उसको उम्र कैद की सज़ा हो सकती है जो दवाइयों में मिलावट करे। दिस लॉ इज़ प्रेजेंट बट सेल्डम इट इज़ टू बी एक्टेड अपॉन। कभी किसी को आज तक एडल्ट्रेशन ऑफ ड्रग्स पे सज़ा तो नहीं हुई, हालांकि मार्केटें जैली दवाइयों से भरी हुई हैं, लेकिन इसकी सज़ा जो है ये इम्प्रिजनमेंट ऑफ लाइफ है। ये ज़फ़रुल्लाह जमाली साहब वज़ीर आज़म थे, उनके दौर में ये जो सेक्शन जो है ना इसकी सज़ा 10 साल से बढ़ा के उम्र कैद की गई थी। खुदकुशी अटेम्प्ट टू कमिट सुइसाइड, attempted suicide. Whoever attempts to commit suicide and does any act towards the commission of such offence shall be punished with simple imprisonment for a term which may extend to 1 year, or with fine, or with both. Now, कोई बंदा अगर खुदकुशी करने की कोशिश करता है तो उसके लिए उसको 1 साल की सज़ा दी जा सकती है और साथ जुर्माना भी किया जा सकता है, और दोनों भी किए जा सकते हैं। So if any person attempted to commit suicide and this case will be registered in the police station, and the imprisonment for the attempted suicide is 1 year simple imprisonment with fine or both. Section 337J, as you already know, you have learned this. Causing hurt by means of poison. Whoever administered to or causes to be taken by any person any poison or any stupefying, intoxicating or unwholesome drug or such other thing with intention to cause hurt to such person, or with intent to commit or to facilitate the commission of an offence, or knowing it to be likely that he will thereby cause hurt, may, in addition to the punishment of arsh or zaman provided for the kind of hurt caused, also punished, having regarded to the nature of the hurt caused, with the imprisonment of either description which may extend to 10 years. So किसी बंदे को अगर कोई जो उसको पॉइजन दे दिया जाए विद द इंटेंशन टू कॉज हर्ट और कॉज डेथ, तो उसके लिए कम से कम 10 साल कैद की सज़ा है। अगर तो वो मर जाए फिर तो उसके ख़िलाफ़ जो है वो कत्ल अमद का मुकदमा दर्ज होगा, और अगर वो बच जाए तो जिस तरह की उसको इंजरी आएगी उसके मुताबिक इस्लामी सज़ा दी जाएगी। इसके अलावा इन एडिशन टू इस्लामिक पनिशमेंट, इन एडिशन टू 10 years imprisonment एज ए ताज़ीर के तौर पे उसको 10 साल कैद की सज़ा हो सकती है। The 337 L1 and L2, you have already known this. Whoever cause hurt not mentioned herein before, which endangers life or which causes the sufferer to remain in severe body pain for 20 days or more, renders him unable to follow his ordinary pursuits. आम जो काम है रूटीन के, for 20 days or more shall be liable to zaman, and also punished with imprisonment with either discretion for a term which may extend to 7 years. So whoever causes hurt not mentioned herein. So this is called the 337 L1. This is important from examination point of view. Whoever causes hurt not mentioned herein before. सो कोई ऐसा हर्ट जो पहले जिसका जिक्र नहीं किया गया, ये एक्चुअली बाद में शामिल की गई है, क्योंकि जब ये इसका किसास एंड दियत का ये ऑर्डिनेंस बनाया गया तो देयर वर 2 टाइप ऑफ पर्सन इन्वॉल्व इन दैट. वन वाज द रिलीजियस लीडर्स एंड अदर वाज द लायर्स. दे बोथ सिट डाउन एंड दे फॉर्म द दिस Qisas and Diyat Act, but they missed the, as you already know, 2 injuries. Number 1 is the bruise, very much common injury, and number 2 is the dislocation of joint. So it was later on it was pointed out by the doctors that 2 injuries are totally missed in the Qisas and Diyat Act. Then instead of including these two injuries in the Qisas and Diyat Act, they include this section into the Qisas and Diyat Act. Whoever causes hurt not mentioned herein before. तो इस तरह उन्होंने दो इंजरी जो हैं वो ब्रूस और डिसलोकेशन ऑफ जॉइंट जो है वो 337L1 में जो है वो डाल दी. इसमें एक ये है कि जो बंदा जो है सीवियर किसी को बॉडी पेन हो, कोई ऐसी इंजरी किसी को लगाए जो कि विच एंडेंजर्स लाइफ, जो ज़िंदगी जो लाइफ को ज़िंदगी को ख़तरे में डाल दे, तो या उसको 20 दिन इतना बॉडी पेन में रखे कि वो बंदा आम तौर पे जो अपने ऑर्डिनरी काम छोटे मोटे काम करता है वो करने के काबिल ना रहे, जैसे उठ के जाना, बाथरूम में जाना, वापस आना, मुँह हाथ धोना, उन कामों के भी काबिल ना रहे, ऑर्डिनरी परसूट के काबिल ना रहे, तो उसको 7 साल कैद की सज़ा हो सकती है. सो whoever causes hurt not mentioned here in before, यानी कि जो हर्ट जो है वो इसमें शामिल नहीं है और कोई ऐसी इंजरी बंदे को लग जाती है जो कि उसकी ज़िंदगी को एंडेंजर्स लाइफ, ज़िंदगी को ख़तरा पैदा हो जाता है, या कोई ऐसा होता है जिसमें कि वो 20 दिन तक वो बंदा जो है उसको वो अपने आम ज़िंदगी के काम काज करने के काबिल नहीं रहता, इतनी सीवियर बॉडी पेन है, तो उसके ऊपर ये सेक्शन लगती है, तो उसमें जो है ये सज़ा है कि वो 7 साल तक उसको कैद की सज़ा दी जा सकती है. सेकंड इज़ द whoever causes hurt not covered by subsection 1. ये है एक्चुअली इस दो पनिशमेंट्स के लिए, एक है ब्रूस और एक है ये डिसलोकेशन ऑफ जॉइंट. सो दिस इज़ कवर्ड अंडर सेक्शन 337L2. L1 is about the any sections not mentioned here in before, and this is the any injury which endangers life or causes sufferer to remain in severe body pain. 20 दिन के लिए उसको इतनी वो ज़ख्मी हो जाए कि इतना पेन हो कि वो उठ के अपने आम काम ना कर सके रूटीन के, तो उसके लिए जो है ना वो L1 है और L2 है, जो दो पनिशमेंट्स इनको दी गई हैं. इसमें से एक जो है वो ब्रूस है और दूसरा है डिसलोकेशन, इसके मुतल्लिक़ है. तो L2 इज़ अबाउट द ब्रूस एंड डिसलोकेशन. ये दोनों जो है 37L1 एंड L2 ये बाद में इसको इंट्रोड्यूस किया गया है, क्योंकि इसमें जो है ना वो ग्रीवियस इंजरी का मसला था कि द इंजरी विच एंडेंजर्स द लाइफ उसको L1 में कर दिया, और ये जो ब्रूस और दूसरे हैं उसको L2 में कर दिया, ब्रूस और डिसलोकेशन को. पाकिस्तान मेडिकल एंड डेंटल काउंसिल एक्ट 1975, PMDC Act 1975, and it was an ordinance issued by the President of Pakistan in 1962, and it was made an act by the Parliament in 1975. The Medical and Dental Council of Pakistan exists to maintain the register of medical and dental practitioners, regulate the standard of medical practice, protect the interests of the patient, supervise the medical education, and give गाइडेंस ऑन द एथिकल इश्यूज़. तो ये काम जो है ये पाकिस्तान मेडिकल एंड डेंटल काउंसिल के ये स्पुर्द हैं. एक तो ये है पाकिस्तान मेडिकल एंड डेंटल काउंसिल है विल मेंटेन द रजिस्टर ऑफ मेडिकल एंड डेंटल प्रैक्टिशनर्स. जो जितने मेडिकल एंड डेंटल प्रैक्टिशनर हैं उनके लिए रजिस्ट्रेशन जो है वो पाकिस्तान मेडिकल एंड डेंटल काउंसिल करती है. दूसरा ये है कि मेडिकल एजुकेशन कि मेडिकल प्रैक्टिस को रेगुलेट करती है. तीसरा करती है कि ये प्रोटेक्ट द इंटरेस्ट ऑफ द पेशेंट करती है. चौथा करती है कि ये सुपरवाइज मेडिकल एजुकेशन करती है एंड गिव लाइंस ऑन एथिकल इशू. एक उसका ये भी काम है कि एथिकल इश्यूज़ के ऊपर जो है वो उसको गाइडलाइन देती है डॉक्टरों को. सो दीज आर द मेन फंक्शंस ऑफ द PMDC. The Pakistan Medical and Dental Council was duly constituted under the Medical and Dental Council Ordinance number 32, 1962 in June 1964 and is empowered to, इसमें तरमीम की गई थी थोड़ी सी 1964 में, look after public interest by maintaining proper medical and dental standards. एक तो ये फंक्शन है. look after public interests by maintaining proper medical and dental standards, supervision of medical dental education in the country. As you already know, there is no Pakistan medical and dental case. This council nowadays there is ad hoc body which is working to look after the daily routine matters of the council, and it is headed by the retired judge of the Supreme Court nowadays. Maintain a register of qualified doctors and dentists qualifying from duly recognized institutions. So it is the registration of the doctors which are qualified, doctors and dentists which are qualified from the duly recognized medical institutions. Then another way is the disciplinary action. Take such disciplinary action which may be required for criminal convictions or serious professional misconduct. For a doctor, the council is not an association of union of protecting professional interest. ये जैसे पाकिस्तान मेडिकल एसोसिएशन है, it has been formed to protect the professional the interest of the doctor, but PMDC is not made to protect the professional interest of the doctor, which is basically made to protect the interest of the public. So take such disciplinary action. So the PMDC is also enabled to take the disciplinary action against the doctors. We will study it, what type of disciplinary action may be taken by the PMDC. We will study it in the next pages. So take such disciplinary actions which may be required for criminal convictions or serious professional misconduct of a doctor. The council is not association or a union for protecting professional interest of the doctors. Proficiency of medical education. So medical education में evaluation of course of studies, evaluation of course of studies of medical qualification. So medical education medical profession को वो कैसे करती है रेगुलेट, तो evaluation करती है कोर्स ऑफ स्टडीज़ ऑफ मेडिकल क्वालिफिकेशन. जो भी मेडिकल क्वालिफिकेशन है पाकिस्तान में, इसमें अंडर ग्रेजुएट के लिए MBBS है, दैन पोस्ट ग्रेजुएट क्वालिफिकेशन है, उसका जो कोर्स ऑफ स्टडीज़ है इट इज़ डिक्लेयर्ड बाय द PMDC. Then minimum qualification of medical teachers, it is also the duty of the PMDC that he will standardize the minimum qualification required to become a medical teacher. If a person want to become a lecturer, what is the minimum qualification, and if he has to be promoted from lecturer to the assistant professor, then from assistant to associate and associate to professor, what minimum qualification is required. It is also decided by the Pakistan Medical and Dental Council. Then the inspection of medical institution and examination by appointing inspectors. जो PMDC है वो अपने इंस्पेक्टर्स की टीम को भेजती है, वो आके कॉलेज का मुआयना करते हैं, लिस्टें वगैरह तैयार करते हैं, कौन सी चीज़ मौजूद है, स्टैंडर्डाइज का जो है वो क्या क्या चीज़ें स्टैंडर्ड हैं, और वो पूरे स्टैंडर्ड के ऊपर पूरा उतरते हैं कि नहीं उतरते, किस डिपार्टमेंट में कितनी रिक्वायरमेंट है और कितनी चीज़ें मौजूद हैं. ये तमाम जो है ये इंस्पेक्टर देख के अपनी रिपोर्ट जारी करते हैं कि जो है वो इसको कॉलेज को रिकगनाइज किया जाना चाहिए या नहीं, या इसकी रिकग्निशन को वापस लिया जाना चाहिए. Privileges and obligations of a registered medical practitioner. It is a university question. Privileges of a registered medical practitioner is a university question. So, number one, privilege of a registered medical practitioner. जो है registered practice जो है, इसके registration जो है उसके privileges क्या हैं. Registered medical practitioners के privileges क्या हैं. Number one, he can acquire a government or army service. So one privilege that he can acquire a job in government department or in army medical services. Number one. Number two, he can issue medical certificate signed by registered medical practitioners or registered dentist are legally valid. Second privilege of registered medical practitioner is that the certificate issued and signed by the registered medical practitioner or the registered dentist, they are legally valid. They are acceptable before the court, acceptable anywhere. So medical certificates which are issued by the registered medical practitioner or the registered dentist, they are if they are issued and signed by the RMP, registered medical practitioner or registered dentist, these certificates are legally valid certificates. Third is he can go to the court to claim medical charges for medical dental services rendered to any person. So third privilege is that he can take the fee from the patient. He can take the fee from the patient, and if after the treatment a patient refuses to pay the fee, then the registered medical practitioner can go to the court to claim medical charges for medical or dental services rendered to any person. So third is that he can charge a fee. He can charge a fee from the patient. This is another obligation. He can charge the fee from the patient, and also if the patient after the treatment or the examination refuse to pay the fee, the doctor, RMP, registered dentist can go to the court to claim the medical charges for medical dental services rendered. उसके ट्रीटमेंट के ऊपर जो खर्चा है उसके लिए जो है डॉक्टर वो कोर्ट में जा सकता है. So there are only three privileges हैं सिर्फ. इसमें जो है ना जो स्टूडेंट्स हैं वो थीसिस लिखना शुरू कर देते हैं कि उसको जो है ना मरीज़ का ख्याल रखना चाहिए, ये करना चाहिए. नो सिर्फ 3 प्रिविलेज हैं. एक ये है कि वो आर्मी में या गवर्नमेंट ऑफ पाकिस्तान हेल्थ डिपार्टमेंट में या किसी डिपार्टमेंट में जहाँ पे ज़रूरत हो वो एज ए डॉक्टर जो है वो सर्विस कर सकता है. गवर्नमेंट के महकमे में या आर्मी के महकमे में वो एज ए डॉक्टर सर्विस कर सकता है. दूसरा ये है कि ही कैन इशू ए सर्टिफिकेट एंड दिस सर्टिफिकेट is valid before the court. Second is that he can issue a medical certificate. Medical certificate may be of disease, of fitness, of age, of a medical legal report, maybe a postmortem report, maybe exhumation report. So all the certificates which are issued by the registered medical practitioner, they are legally valid. So second and third is that he can charge the fee from the patient. Mutually agreed fees he can charge from the patient. जैसे वो कहे जी कि मैं अपेंडिक्स के ऑपरेशन के I will charge 20,000, 30,000, 50,000. So if they are mutually agreed and after the treatment ऑपरेशन के बाद अगर जो है वो मरीज़ जो है वो इनकार कर दे कि मैं पैसे नहीं दूंगा, so doctor can go to the court to claim that charges. So these are the only 3 privileges. Please keep it in mind that this is a university question. Describe the privileges and obligations of registered medical practitioner. So number 1, he can take a job in government or army service. Number 2, the certificate which are issued by the RMP, they are legally valid. And third is that he can charge the fee from a patient, and if the patient after the treatment refuse to pay the fee, he can go to the court to claim the fee. So these 3 are the only 3 privileges of RMP. Then the responsibilities of RMP or registered dentists. So there are only two responsibilities. Only two responsibilities. Number one, notify any change in address, place of practice within 30 days in writing. So only two responsibilities of registered medical practitioner. One is that if any change in address, his residential address or address of place of practice. So he should inform the PMDC within 30 days in writing. So a doctor is bound to inform any change in the residential address or any change in the address of the practice. He should inform the Pakistan Medical and Dental Council within 13 days in writing. So this is the one responsibility. And second responsibility, second obligation is not to use any name, title, description or symbol so as to lead to a person to believe that he possesses extra qualification which are not conferred, granted to him. दूसरा उसका ये है कि he should not mention any qualification which he has not conferred. So education, so any qualification जो उसने हासिल नहीं की या उसको ग्रांट नहीं की गई, grant is not granted, he should not mention with his name. If he is MBBS, he should write down only MBBS. And if he is FCPS or any diploma has been done by the doctor, he should mention only those qualification which has been conferred or granted to him. जो उसको जो PMDC ने जो उसके पास क्वालिफ़िकेशन उसने हासिल की है, और दूसरा यह है कि वो क्वालिफ़िकेशन PMDC में रजिस्टर्ड भी होनी चाहिए. It is also a condition. So only two responsibilities, three privileges and only two obligations or responsibilities of RMP and R&D. So only two responsibilities. One, that if any change occurs in the residential address or the place of practice, the doctor should inform the PMDC in writing within 30 days. And second is any qualification which he has not conferred or granted or is not registered with the PMDC, he should not mention with his name any qualification which he has not qualified from any institution. So now two only responsibilities: notify any change in the address, and second is the कोई ऐसी क्वालिफिकेशन जो उसके पास नहीं है उसको उसके अपने नाम के साथ मेंशन नहीं करना. If he is an MBBS doctor, he should write down that he is the MBBS only, not FCPS and other diploma courses. And the PMDC के जो हैं ये जो disciplinary action taken by the Pakistan Medical and Dental Council. So he can take any disciplinary action, PMDC can take any disciplinary action against the doctor. So the complaints from the patient, from the hospital administration, from the court, they all are addressed to the President of the Pakistan Medical and Dental Council. So frivolous complaints, they are rejected. बाकी जो कंप्लेंट है उसको वो डिसिप्लिनरी कमेटी के हवाले कर देते हैं. सो उसके लिए जो है अगर तो वो तहकीकात करते हैं, अगर तो वो जो है वो इल्ज़ाम गलत है, झूठा है, साबित नहीं हो सका तो कंप्लेंट इज़ डिसमिस्ड. और अगर तो नंबर 2, सो name suspended for a certain period and name erased from the register permanently. So PMDC can award 3 types of punishment to a medical doctor. PMDC can award 3 types of punishment to a registered medical practitioner or registered dentist. Number 1 is the warning, and the word admonition is used in place of warning. So number 1 punishment is the warning. 3 punishments may be awarded by the PMDC. PMDC is authorized only for the three punishment. Number one is the warning. So warning or admonition, ADMONITION, admonition. So the number one is the warning or admonition. Number two, his name is erased from the list for a certain period. His registration is suspended for certain period, for 1 month, for 2 months, for 6 months, for 1 year. So during that he cannot practice, he cannot see the patient, he cannot issue any certificate to any patient. So his name may be suspended, he may be suspended for a certain period. So his name may be removed from the register for a certain period. And third punishment is that permanent erasure of the name from the register is made. So if the name of the doctor is removed permanently from the register, it is called professional death sentence. So forever a doctor cannot see a patient, cannot write a prescription, cannot issue any medical certificate. So it is called the professional death sentence. Permanent erasure of name from the register is the professional death sentence. So only three types of punishments can be awarded by the court. Number one is the warning or admonition. Number two is the erasure of name of the doctor from the register for certain period. And then third is the permanent erasure of name of the doctor from the register. So only these three punishment can be awarded by the PMDC. So if the doctor is involved in any criminal activity, then the case is referred to the court for that criminal activity, as if by this negligence of the doctor, the patient dies, then the case is referred to the court. So only three types of disciplinary action may be taken. Number one is the admonition or this warning. Number two, erasure of name from the register for certain period. And number three, permanent erasure of name of the doctor from the register, professional death sentence. Now, removal of name from register. If conviction of any offense as implies to a defect of character by the counsel, if there is any defect of character proved against the doctor, then his name may be removed from the register. So name may be removed from the register for certain period or for permanently. If found guilty of infamous conduct in any professional respect, after inquiry, if he is found that he is infamous conduct, so then his name may be removed from the register. And third is, if shown unfit to continue in medical practice on account of mental ill health or other grounds. So in that case, three type of this cases on which a doctor's name may be removed from the register. It may be for a certain period or it may be permanent removal. So if conviction that a person has, a doctor has defect of moral character, then his name may be removed. Or if infamous conduct, if he is found of infamous conduct, guilty of infamous conduct, then his name may be removed. Or the doctor has got some mental disease, he is unable to practice, or on other grounds, physically he is handicapped and cannot practice, mentally handicapped, cannot practice. So in that case, his name may be removed from the register. Counsel can also restore name to register if deemed fit. After as recovery of the mental health, the counsel can also restore the name of the doctor on the register. Serious professional misconduct is a university note. What is serious professional misconduct? Give examples. So anything done in pursuit of profession by a medical man which will be reasonably regarded as disgraceful or dishonorable by professional colleagues of good repute and competency. सो डॉक्टर कोई ऐसा काम करे अपने प्रोफेशन को परसू करते हुए जो कि जिसको कि आम जो अच्छी रिप्यूट के डॉक्टर हैं वो इसको कहें कि नहीं ये डिसग्रेसफुल भी है और डिसऑनरेबल भी है, इसको नहीं ये काम नहीं करना चाहिए था, तो डैट इज़ कॉल्ड द सीरियस प्रोफेशनल मिसकंडक्ट. Anything done in pursuit of profession by a medical man which will be reasonably regarded as disgraceful and dishonorable by professional colleagues of good repute and competency. जो आम डॉक्टर उसी तरह के जो हैं जो जिनकी रिप्यूट भी अच्छी है और जो कॉम्पिटेंट भी है, अगर वो कह दें कि नहीं इस डॉक्टर को ऐसे नहीं करना चाहिए था, इट इज़ disgraceful, dishonorable, this act is dishonorable, so in that case he is found to be this serious professional misconduct. He has committed the serious professional misconduct. अगर अच्छी रिप्यूट के डॉक्टर कह देंगे नहीं इसको ये नहीं करना चाहिए था, ये डिसऑनरेबल भी है और डिसग्रेसफुल भी है एक डॉक्टर के लिए, तो वो जो है वो ही विल बी फाउंड गिल्टी ऑफ सीरियस प्रोफेशनल मिसकंडक्ट. Now this is the serious examples of serious professional misconduct. Criminal conviction involving moral turpitude. If this doctor is morally corrupt, then he is the guilty of serious professional misconduct. If he adultery with the patient, if he sexually involved with the patient, then he is the guilty of serious professional misconduct. If he commit the criminal abortion, then he is also guilty of serious professional misconduct. And if he use the alcohol and see the patient while under the effect of alcohol, perform any operation while under the effect of alcohol, he is guilty of serious professional misconduct. And association with unqualified person, ये अनक्वालिफाइड पर्सनस वो होते हैं जो आमतौर पे जो प्राइवेट अस्पतालों में अनक्वालिफाइड जो है ना पर्सन वो रख लेते हैं, जैसे ये स्टाफ नर्सें रखते हैं वो क्वालिफाइड नहीं होती, अंडर मैट्रिक लड़कियां जो हैं वो स्टाफ नर्सें रख लेते हैं. सो इट इज़ द एसोसिएशन विद अनक्वालिफाइड पर्सन. इसी तरह जो है वो लड़के जो हैं वो अंडर मैट्रिक रखे होते हैं डिस्पेंसर के तौर के ऊपर, तो ये तमाम जो है ना ये एसोसिएशन विद अनक्वालिफाइड पर्सनस कहते हैं. इट इज़ आल्सो ए सीरियस प्रोफेशनल मिसकंडक्ट. सो एंड अदर इज़ द सिक्स्थ नंबर इज़ द एडवर्टाइजिंग. नो एडवर्टाइजिंग इज़ डन बाय ए डॉक्टर, नो एडवर्टाइजमेंट. ही कैन only in newspaper he may mention the timing of his practice, or he may mention in an advertisement he can mention the time of practice and the address of practice. So no advertisement should be made in the press, in the media by the doctor. And if he is found advertising himself in the media or in the newspaper, he is found to guilty of serious professional misconduct. Then dispensing controlled drug. The drugs which usually cause the addiction, if doctor dispense these drugs, then he will be found to be guilty of serious professional misconduct. ये 7 एग्जाम्पल है serious professional misconduct की. Duties of medical and dental practitioners. So duties of physician in general, जो आम तौर पे ड्यूटीज़ हैं, maintain a highest standard of professional conduct. Second, active participation in continuous medical education. ये नहीं है कि डॉक्टर बनने के बाद बस किताबें संभाल के रख दी और बस और कुछ नहीं करना, सिर्फ प्रैक्टिस करनी है. नो, he should take part in continuous medical education. ये कंटिन्यूस मेडिकल एजुकेशन, ख़ासकर जो एजुकेशन टीचिंग में बंदे इन्वॉल्व हैं, इनके लिए तो बहुत ज़्यादा ये ज़रूरी है कि वो एक्टिवली पार्टिसिपेट करें जो है ना वो कंटिन्यूस मेडिकल एजुकेशन में, जो नेक्स्ट जो नए वो कोर्सेज करें, जो इसमें कॉन्फ्रेंसें अटेंड करें, वर्कशॉप अटेंड करें. तो ये है कि ही शुड एक्टिवली पार्टिसिपेट इन द continuous medical education. Then the motives of the Prophet ये है कि अपनी जो पोजीशन से वो नाजायज़ फ़ायदा ना उठाए और जितना उसका जायज़ फ़ीस बनती है वो रखे. जैसे अब इस्लामाबाद में कुछ जो पेयर स्पेशलिस्ट हैं, दे आर टेकिंग 10,000 पर पेशेंट फ़ी, सिर्फ उन्हीं एग्जामिनेशन फ़ी. So there should be no, the profession should not be only for collecting the money from the other persons. So there should be a reasonable amount of profit. Then provision of competent medical services in full technical and moral independence with compassion and respect of human dignity. So provision of competent medical services जो है वो provide करनी चाहिए उसको तमाम पेशेंट्स को, dealing honestly with patients and colleagues and strive to expose those physicians deficient in character and competence or who engage in fraud or deception. उसको जो अपने मरीज़ के साथ बिल्कुल जो है ऑनेस्टली डील करना चाहिए, कोलीज के साथ भी, और जो है दूसरे जो इस तरह के फिजिशियन हैं उनको एक्सपोज करना चाहिए जो कि जिनका कोई डेफिशिएंट इन करैक्टर है, करैक्टर जिनका ख़राब है, ये फ्रॉड और धोखेबाजी करते हैं. Then the duties of physician to the sick. It is the duty of the physician to preserve the human life. He should preserve the human life. ज़िंदगी बचाना उसकी ड्यूटी है. Then the complete loyalty and use of resource of science. जितने भी उसके पास रिसोर्सेज हैं या जो भी रिसोर्सेज मौजूद हैं उनको इस्तेमाल करे. अगर MI की ज़रूरत है तो MRI करवाए, अगर CT स्कैन की ज़रूरत है CT स्कैन कराए, एक्सरे कराए, जो भी टेस्ट ज़रूरत है वो उसको कराए. तो अगर वो ये समझता है कि इसके लिए जो है वो उसकी जो है नॉलेज से बियॉन्ड है कोई मरीज़, तो उसको स्पेशलिस्ट के पास रेफ़र करना चाहिए, कंसल्टेंट के पास रेफ़र करना चाहिए. रेफरल ऑफ द पेशेंट. देन द प्रोफेशनल सीक्रेसी. So as you know, this is the professional secrecy or professional confidentiality. Any information known by the doctor during history taking or the examination should be kept up to the doctor, and it should not be leaked to any person. The professional confidentiality is maintained, should be maintained. Emergency care as an humanitarian duty. अगर उसको emergency की ड्यूटी है तो उसको जो है ना पूरी तरह वो करनी चाहिए. ड्यूटीज़ ऑफ फिजिशियन टू ईच अदर. जो डॉक्टर हैं अगर किसी डॉक्टर को बीमार हो गया, डॉक्टर दूसरे के पास जाता है, ड्यूटीज़ ऑफ फिजिशियन टू ईच अदर, तो उसका जो है डॉक्टर का बिहेवियर प्रॉपर होना चाहिए. और दूसरा ये है कि ये नहीं है एंटाइज पेशेंट फ्राम हिज कोलीग्स, दूसरों से जो है ना वो मरीज़ जो है ना वो छीन के तो वो ले गई, इस डॉक्टर को तो पता ही कुछ नहीं है, इसको तो आता ही कुछ नहीं है, तो दूसरे मरीज़ों जो है ना दूसरों के मरीज़ जो है ना वो अपने क्लिनिक पे लेके आए. ये नहीं करना चाहिए उसको. और इसको ग्रेटेस्ट ट्रीटमेंट टू कोलीग्स, देयर स्पाउस एंड चिल्ड्रन. सो इट इज़ आल्सो ड्यूटी of the doctor towards each other that he should provide the treatment free of cost to the doctor, to his spouse, her or his spouse and children. They should be treated free of cost. So these are the duties of physician to each other. Next is the mercy killing, euthanasia. Euthanasia, mercy killing. This euthanasia or mercy killing means a gentle and easy death. The means of bringing about a gentle and easy death. Action of inducing a gentle and easy death, putting painlessly to death of those suffering from incurable and extremely painful diseases. Sometimes the person is at the last stage of cancer and he is suffering extreme pain. He is suffering extreme pain, and it is quite clear to the doctor that this patient is incurable और उसका जो है वो ये वापस नहीं आएगा, and he will have to die. Then induction of a gentle and easy death. So ये जो है उसको मार देना उसके अपने बेनिफिट के लिए, this is called the यूथेनेसिया और मर्सी किलिंग। जैसे एक बंदा है उसको हाइड्रोफोबिया हो गया है, हाइड्रोफोबिया इज़ द डिजीज़ विच रिजल्ट फ्राम द बाइटिंग ऑफ द रैबिट डॉग। ये जो हल्का कुत्ता होता है इसके काटने से ये जो है डिजीज़ हो जाती है, हाइड्रोफोबिया कहते हैं इसको, रेबीज़ भी कहते हैं इसको। सो द पर्सन फ्राम रेबीज़, वो जो मरीज़ है वो दूसरों को काटता है और जिसको वो काटता है उसको भी रेबीज़ हो जाता है, और जो है पानी से उसको बहुत ज़्यादा डर लगता है। तो वो इस तरह जो है ना फिर उसको घर वाले जब अस्पताल में लेके आते हैं तो ये एक इनक्योरेबल डिजीज़ है, इसका कोई इलाज नहीं है। तो इस सिलसिले में फिर वो उसके लिए ये है कि उसको जो है वो उसको पेनलेसली किसी तरीके से उसको मार दिया जाए। तो उसको ये कहते हैं क्योंकि उसने बचना तो वैसे भी नहीं है और वो जितनों को काटेगा उतने ही ज़्यादा वो रेबीज़ फैलती जाएगी, जिसको वो काटता है उसको भी रेबीज़ हो जाती है। तो इसके लिए जो है वो डॉक्टर जो है वो या उसके लवाहकीन डिसाइड करें कि इसको मार दिया जाए। तो दिस इज़ कॉल्ड द यूथेनेसिया। यूथेनेसिया इजी डेथ। Euthanasia is the deliberate killing of a person for benefit of that person. This is the जानबूझ के killing of a person for benefit of that person. एक मरीज़ है वो 4th स्टेज ऑफ कैंसर के ऊपर है, शदीद उसको दर्द हो रही है और ये क्वाइट क्लियर है कि ये अब इसने बचना वैसे भी नहीं है, तो उसको पेन को ईजी करने के लिए जो उसको मार दिया जाए जो है, तो इसको कहते हैं यूथेनेसिया और ईजी डेथ। So euthanasia is the deliberate killing of a person for benefit of that person. Another definition, euthanasia, the act or practice of killing or permitting the death of hopelessly sick or injured individual in a relatively painless way for reason of mercy. So is called the euthanasia. Another definition, act or practice of killing or permitting the death of hopelessly sick or injured individuals in a relatively painless way for reason of mercy is called euthanasia. जैसे कोई बंदा है उसको जो है रैबिट डॉग ने, हल्के कुत्ते ने काट लिया है तो उसको रेबीज़ हो गई है, हाइड्रोफोबिया हो गया है, तो वो अब दूसरों बंदों को उसका कोई ट्रीटमेंट नहीं है, उसने बचना वैसे भी नहीं है, वो जितने दूसरों बंदे को काटेगा उसको भी रेबीज़ हो जाएगी। तो अगर जो है उसकी बेनिफिट के लिए उस बंदे को पेनलेसली मार दिया जाए तो दैट इज़ द यूथेनेसिया। Another definition, intentional termination of life of one human being by another suffering from incurable or painful disease. Again the example is the person suffering from the rabies, from the hydrophobia, or the person is at the 4th stage, last stage of the cancer. So in that case he is killed painlessly to mitigate, to lessen his sufferings. Practice of another definition, terminating the life of a person with an incurable disease, intolerable suffering, or possibly undignified death in a painless or minimally painful way for the purpose of limiting suffering. Another definition the same way. Types of euthanasia, 2 types, passive euthanasia and active euthanasia or aggressive euthanasia. In passive euthanasia is withholding of common treatment. Passive euthanasia means the common treatment is withheld, as antibiotics, drugs are withheld, or if the surgery has to be performed, it is deferred, or giving a medication such as morphine to relieve pain, knowing that it may also result in death. So passive जो है euthanasia, उसमें जो ट्रीटमेंट को विदहोल्ड करते हैं, जैसे जो है उसकी एंटीबायोटिक्स को दवाओं को रोक लिया ताकि ये जल्दी इसकी डेथ हो जाए, या उसको मार्फिन लगानी शुरू कर दी पेन की किल करने के लिए, हालांकि पता है कि मार्फिन से भी इसकी डेथ हो सकती है या इसको एडिक्शन हो सकती है, तो इसको भी जो है पैसिव यूथेनेसिया कहते हैं. और द रिमूवल ऑफ द दिस वेंटिलेटर इज़ आल्सो ए पैसिव euthanasia. Then the active euthanasia, aggressive euthanasia, then here the death is caused by using lethal substances or forced to kill a person. इसमें यह है कि heavy dose of depressant medicine is given intravenously and the person dies. So this is the aggressive euthanasia. In aggressive euthanasia, lethal substance is used. Or forced to kill a person, ये aggressive euthanasia है. उसमें जो है passive euthanasia में उसमें treatment को withhold करते हैं. अगर उसको वो उसके जो है वेंटिलेटर पे है तो वेंटिलेटर को जो है रिमूव कर देते हैं. तो ये पैसिव है. एग्रेसिव में कोई ऐसा सब्सटेंस लीथल सब्सटेंस यूज़ करके उसको मार देते हैं. देन द असिस्टेड सुइसाइड, फिजिशियन असिस्टेड सुइसाइड. This is the physician assisted suicide. The patient self administer the lethal dose that has been prescribed by a physician who knows the patient intends to use it to end his or her life. Physician assistant जो है suicide है. ये कुछ मुल्कों में इसको अदाउ किया गया है कि वो जो है वो डॉक्टर के जो है ना मशवरे के साथ जो है वो बंदा सुइसाइड कमिट कर लेता है. तो पर्सन वो कहता है आई डोंट वांट टू लिव एनी मोर इन दिस वर्ल्ड, सो द डॉक्टर विल प्रिस्क्राइब द ड्रग इन द लीथल डोज एंड द पर्सन हिमसेल्फ टेक टू किल हिमसेल्फ. दिस इज द फिजिशियन assisted suicide. Then the third professional MBBS, ये theory marks हैं 45 MCQs of 1 mark each. 45 MCQs के हैं, 45 marks ही SCQs के हैं, 9 SCQs of 5 marks each. So internal evaluation is of 10 marks, so total is 45 MCQ, 45 SCQ and 10 for the internal evaluation. Total is 100 marks of theory paper. Then the practical paper. Practical is the 40 marks. So there is 8 non-observed station of 4 mark each and 2 observed station of 4 mark each. Total marks is the 40 mark of OSPI. This is OSPI examination. 10 points are there. 8 stations are non-observed stations and 2 are the observed station. Each station carries 4 marks, total 10 station and total practical 40 marks. Notebook carries 10 marks. And the Viva OC, these are totally 40 marks. 20 marks with internal examiner, 20 marks with external examiner. So 40 marks practical के, 40 वाइवे के, 10 marks जो हैं वो दोनों जो हैं वो नोटबुक्स के और इंटरनल एवेल्यूएशन के 10 marks हैं. तो टोटल 100 marks हैं. 100 marks of वाइवा and 100 marks of theory. Total 200 marks. With 20 marks of internal evaluation, 10 from theory and 10 of this practical. Excellence is not a destination, it is a continuous journey that never ends. Brian Tracy saying, you may know it. Brian Tracy is very famous writer. Excellence is not a destination. It is a continuous journey that never ends. Now, this is all about the forensic medicine. Forensic medicine में जो पढ़ाना था, this is the course which was allotted to me. Then next lectures will be taken by डॉक्टर इकबाल साहब जो हैं वो अगले लेक्चर्स लेंगे. वो आपको स्पेशल टॉक्सिकोलॉजी पढ़ाएंगे. तो अगर अल्लाह करे इंशाल्लाह ताला, आई होप के कॉलेज जो हैं वो इंशाल्लाह ताला जून में खुल जाएंगे. तो उसमें हमें जितना भी टाइम मिला, जो इम्पोर्टेंट टॉपिक हैं हम इनको क्लास में फिर रिवाइज़ करेंगे इंशाल्लाह ताला. ठीक है ना. तो अगर आपको कोई मसला हो, कोई चीज़ पूछना चाहें, यू आर ऑलवेज वेलकम्ड. हम आपके साथ हैं हमारी दुआएं आपके साथ हैं। अल्लाह ताला आपको सेहत और ज़िंदगी दे, अल्लाह ताला आपको कामयाबी दे, कामरानी से आपको हमकिनार करे। वी आर एट योर सर्विस एनी टाइम, विशिंग यू ऑल द बेस्ट ऑफ लक फॉर द कमिंग एग्जामिनेशन एंड इन ऑल फ्यूचर एंडेवर्स ऑफ योर लाइफ। आप हमारे बच्चों की तरह हैं, बेटे और बेटियों की तरह हैं। किसी वक्त भी आपको कोई ज़रूरत पेश आए, कोई क्वेश्चन का मसला, कोई कुछ हो, यू कैन आस्क एनी टाइम। अगर हमें मौका मिला तो हम इंशाअल्लाह ताला आपके कुछ टॉपिक्स जो हैं, इन जो इम्पॉर्टेंट टॉपिक हैं, उनकी क्लासें भी लेंगे। अल्लाह ताला आपको खुश व खुर्रम रखे और कामयाबियाँ अता फरमाए। ऑल द बेस्ट ऑफ लक। अल्लाह हाफ़िज़। थैंक यू वेरी मच।